Hi, this is Sarah McClellan with Pixels and Pills. We're in Boston at DTC National Conference. I'm with Jamie Turner, who is the co-author of How to Make Money with Social Media. Now, you just spoke in session, and it was a fantastic discussion. Let's first get a little bit about your history and what led you to be here speaking at the event today, and then if you want to touch on your major points from the session.
Sure, yeah. I ended up starting an online magazine called The 60-Second Marketer, and it was basically a place where marketers could go in and in 60 seconds watch a short video about the newest trends or read a short blog post about the newest trends. Well, to market the 60-Second Marketer, I didn't have any money. Right. So we went in and said, okay, how are we going to do this? Well, I'm going to have to use LinkedIn, Twitter, Facebook, all that sort of stuff. Did it. We started having traffic increase. All of a sudden, I knew how to do social media. Right. So ultimately went to a publisher and said, hey, I know a little bit about social media, and I've got a co-author, and the publisher said, sure, we'll publish a book. So next thing I know, I've got a book out called How to Make Money with Social Media, and theoretically, I know what I'm talking about. Now, don't you tell anybody that I have no clue what I'm talking about, but that's what they tell me. Yeah. But yeah, so we started out doing that, and the thing I talked about today was basically, what are the 5 biggest lies of social media? And we went through a bunch of different things. One of the things we did talk about was the different ways that corporations are using social media to make money. And believe it or not, if you look at all the social media campaigns out there, there's really only 5 different buckets that social media campaigns fall into. One is they'll use it as a branding tool. And mostly they're using that as YouTube videos, things like that. The second is they use it as an e-commerce tool. So the e-commerce tool drives everybody to a landing page on the website where they convert those prospects into customers. The third way people are using it is as a research tool. Hey, we want to stay in touch with our customers, find out about them. The fourth way people are using it is as a B2B lead generation tool, which basically is a way for people to kind of capture data and information and go ahead and use that to remarket to people. And the fifth way that people are using it is basically as a customer retention tool. So Delta Airlines might be on watching what's happening on Twitter. If they see somebody tweet that they've lost their bags, they can reach out to them and say, hey, we'll help you find the bags, let's do that. Right. So those are the 5 big ways that people are using social media.
And how are you seeing the change with, the innovations that are happening and pharma using social media and being able to use it sort of in this, temporary way before the FDA makes their guidelines? How are you seeing this change?
That's the big issue, is when is the FDA going to give us some guidance on it? I would suggest that pharma gets into social media, and most of the people we talked to today were in social media in some way, shape, or form, and start building up the infrastructure for your social media campaign using one of those 5 models that I just talked about, or many of the 5 models, and set things up so that when the FDA gives the final guidance, you can continue to move on. But in the meantime, you have to participate in the conversation. And I understand and I know that we can't really go in and have comments on because of some of the legal issues behind that. But that doesn't mean that you can't be part of the dialogue going on out there, or at least go out and brand your product or brand the disease. So you're going out and saying, hey, guess what? You may have ADHD. I want to let you know about some of the things going on with ADHD. We want to help you and give you tips on how to deal with ADHD. Well, that's something that would be relevant to a lot of people, myself included. And so we're going in and basically saying, hey, here's some tips on how to cope with ADHD. And that makes me go, okay, cool. If and when I'm ready to get the medicine, I know the company's sponsoring this and things like that. So you can participate in the conversation, knowing that you can't do comments, but you can at least go out and brand symptoms and the other things out there as part of the overall conversation going on.
Something that I found interesting is you spoke about pharma's presence on YouTube, or their lack of presence. Did you find that interesting when you searched pharma and found that it wasn't really the companies or the marketers or the representatives, it was more about patients on there talking about their drugs or what was going wrong? Yeah,
that's an issue, because if the challenge is with conservative industries, and pharma would be in a conservative industry, understandably so, they're going in saying, we don't want to get involved because of the FDA, because of all these issues. My point of view is, you can still talk about the issues that are out there without necessarily going out and breaking any of the guidelines or the rules that do exist, some of them that are out there right now. So when you go onto YouTube and you search for some of the pharmaceutical companies, and all you get are people complaining about the drugs, and the pharma companies are not at least going out and saying, here's some information on this issue, here's some information that you should have on this. The fact that they have zero presence just means 100% of the conversation is what the consumers are doing. My point of view is, if you are sitting at let's go back to middle school. You're sitting at a party, you're in middle school, there's a couple of kids over there talking bad about you. Right. You got two choices. Ignore them and let them spread the rumors, which are not true. Right. Or go over and participate in the conversation so that you can say, so that they'll walk away going, hey, they weren't so bad. I would suggest that the pharma industry needs to say, let's be in the conversation, knowing that we have guidelines that we have to stay within. But if we at least are there, then we're not letting other people spread negative or incorrect information out there. So that's one of the key things I'd suggest.
Well, thank you so much, Jamie, for speaking with us today. If people want to find out more information about yourself or the book, is there a website or somewhere they can go to find you?
Yeah, thanks for asking. The book's called How to Make Money with Social Media. My name is Jamie Turner. I also run BKV's 60-Second Marketer. And if you just Google Jamie Turner or Social Media ROI or the 60-Second Marketer, you'll see all the links there, and you can get me there.
Fantastic. Well, thank you so much. This is Sarah McClellan in Boston with Pixels and Pearls.